Hello, my name is Jason Goza. I have a doctorate in chiropractic. My paper focuses on not only the increasing cost of medical care, but the increase in insurance costs and premiums, which lead to the poor families not being able to afford medical care. This affects us on a global scale because costs of basic medical need is increasingly expensive. Healthcare as a basic need comes after food, shelter, and monthly bills, so poor communities globally view healthcare as a commodity and not a necessity. In my paper, I am wanting to shed light on the global problems as I see them, increasing costs to the family and maybe some solutions, or a way to help out with lowering the healthcare costs. First and foremost, I am a chiropractor, so a lot of proposed solutions are going to be in my field. Do I think chiropractic can solve all of our health problems? Probably not, but I do think it would aid in patient care, and when used, co-managed with a family physician, can focus on preventing disease instead of a symptom-based medical model. There have been many changes in Western-style healthcare in the last century. These changes have been fantastic for innovation, patient care, rules and regulation, along with insurance companies, pharmaceutical, and shareholders. With an improvement in medicine, people are living longer, though sometimes at a diminished lifestyle. The increase with technology and innovation comes at a price that is passed on to the patient. In 2018, the American Diabetes Association stated the American cost for diagnosis and treatment increased $72 billion per year when comparing 2012 through 2017. Keep in mind, this is only one example of a lifestyle disease that can be 100% prevented with diet and exercise. The American Diabetes Association has included in their figures type 1 diabetes, which is a deficiency disease, not a lifestyle disease. The figures that are increasing include type 2 and type 3 diabetes. There needs to be a change in not only pricing for your own personal well-being, but a change in how we think about health and what it means to be healthy. A major global problem that has been facing countries around the world are an increasing number in asylum seekers and refugees. Their vast numbers add a burden to the host country's resources and financial budget for medical allocation. Amara and Al-Junid stated, by the end of 2010, there were 15.4 million refugees and about 0.8 million asylum seekers worldwide, 2014. Doctors of Chiropractic can be a portal of entry healthcare in this case to decrease the burdening of so many displaced people to the region. Initial diagnosis would consist of in-depth history taking to get a complete picture of the patient's lifestyle and conditions that may be affecting healthcare. X-ray can be taken to get a picture of structural health, degeneration, incidental findings like cancer, and spinal assessment and treatment could check for instability, joint motion and function. From this picture, we would be able to give a focused referral to point patients in the right direction for their health care. Cody, Sutton, Nicole, Brown, and Meyer in 2019 states, educating communities in posture, manual handling, and basic self-help measures has the potential to position chiropractic as the expert in spinal health. They also stated that in just America, there are almost 50 million people that live without health care, 2012. Chiropractic can be a useful tool for patients because it empowers and teaches them that while a doctor is knowledgeable, they, as the patient, are ultimately in control of their health.